Here with Dr. Kevin Huff, oral facial pain specialist in Dover, Ohio, and general dentist. And we're going to talk today about TMJ. What do you have to say about that, Dr. Huff?
Well, first of all, if you tell me that you have TMJ, I would like to say congratulations, you have two. The word TMJ stands for temporomandibular joint. So that would be equivalent to knee or elbow. I think what you really probably want to ask about is temporomandibular disorders, or TMD. And, this is a very, very, very complex topic. Although people will diagnose, physicians and dentists will diagnose TMD. And what they don't realize, and then they'll direct treatment towards TMD. That's very hard to get an effective treatment for TMD because there are over 40 specific diagnoses for temporomandibular disorders. So what we have to do is decide on what the specific diagnosis is and then direct appropriate treatment towards that diagnosis.
I had no idea there were 40 different diagnoses for TMD.
There's actually over 40. Yes.
Over 40. So what would you say are the most common ones?
Well, the most common ones that most people are familiar with are a disc displacement with reduction. In other words, that is where your joint, when you open, it clicks, it pops. Mm-hmm. Most of the time that is without pain. So we don't focus on treating joint noises. What that tells us is there's an injured joint, there's injury to that joint. It's kind of like a Civil War battlefield that has a lot of ruts and grooves that have never been filled in. Okay, the ruts and grooves are always going to be there, but there's no more Civil War. So same thing with the joint. The joint, once the ligaments are torn or stretched, there's always going to be joint noises. So unless there's pain associated to it, we don't necessarily focus on treating those joint noises. That's the most common one. Some of the more severe are things like degenerative joint disease or osteoarthritis. A lot of times rheumatoid arthritis affects the joints, the temporomandibular joints. And of course, injury, you can have some significant injury to the joints. And then we have a lot of muscle problems. So one of the areas that we cover is muscle disorders that relate to that. In fact, many of the problems and pain associated with the temporomandibular joints are related to musculature. So muscle pain is usually the most common TMJ disorder that we deal with. And that we can treat. And the good news is we can actually treat that very effectively.